if your brain doesn't decide you have pain, then you don't have pain. You know, I preface all these conversations I have with patients with a reminder that, look, I don't want to say anything that's going to minimize their pain. Because I think when I say something like all pain resides in the brain, I'm not at the same time saying it's all in your head. Those are two different things. And I'm saying this as a neuroscientist. But all pain is in the brain. That I don't want that to sound minimizing, okay? But that is where pain is. Pain is in the brain. If your brain doesn't decide you have pain, then you don't have pain. And by the way, the flip is also true, which is the brain can decide you do have pain.
Because it feels very real. But if you could just open your mind to the possibility that maybe you don't need to fix your back or your leg or your neck, maybe that part of the solution is really addressing the memory loop that's playing in your head, that opens up a whole different possibility and an avenue of treatment and pain relief
Yes.
that you haven't even considered.